Dr. Nazari, what's happening when people come in with a denture and the denture starts getting a little wiggly-woggly, it doesn't fit so well anymore, it becomes very uncomfortable, starts falling out more often than one wants, and people want it repaired. And they quite often, think that the denture was made in a way that it broke down, but apparently them is not so, talking to you dentists. Can you explain this to us?
Well, when the patient loses their teeth, all their teeth, and receives the denture for the first time, there is more bone that denture can sit on to support the denture. But over time, the bone that supports the teeth, because there is no more teeth, it starts going away. The body starts resorbing that pieces of bone that are used to support the teeth. And then that's when the denture end up becoming, loose and looser over time. So for the second and third time when the patient wants to receive the new dentures, so it gets harder and harder for the dentist to fabricate a denture that can sit properly. That's what these days, in the past 10, 15 years, we suggest before you end up losing all your teeth. First of all, do not lose your teeth. See the dentist on a regular basis in order to save them. And if there is a patient who's unfortunate to lose their teeth, we recommend to receiving implants immediately so they can support the bone that used to hold the teeth. And if the patient ends up getting dentures, so those implants can hold the denture for the patients. They can have their denture not wobbling around in the mouth.
All right. So what you're saying is, when you have lost your teeth, the bones start shrinking. And what you're saying is that if you put in implants in it, the bone will not shrink because the body feels like the root, the tooth is there and keeps the bone working. And obviously, if and when the bone shrinks, like with dentures, so is that the reason people have this caved in, dried out tomato-looking feeling look actually when they wear dentures for a long time, or otherwise have missing teeth, all over the place?
Yes, because of the lack of bone.
So basically, a dentist is a good plastic surgeon. No Botox needed. Just keep your.
In many cases, you don't need a facelift. You just need properly sitting dentures.
Properly sitting dentures, or probably, or in the first place, when the teeth starts missing, if you let it go that far for whatever reason, put an implant, because that also will that will definitely protect your bones from shrinking, and then you don't start looking 5, 10, and 15 years older than you are because your bones were shrinking.
Yes.
Absolutely wonderful, So not only do you have then a nice smile, which we all want, not only can you chew properly, which we all want, not only can you taste your food properly because there's no plastic around your gums and all whatever it might be, but you also look good.
Yes.
I love it.
Just all the wrinkles and all the lines on the face.
Right. So let me ask you, if a person for some reason lost all his teeth or almost, and you need to pull them out, and it's a question between dentures and implants, and a person just simply doesn't have the money for the implants, because obviously they do cost more than a denture. Would it be wise for that person to, so to say, start saving away every week, every month, so that in a year, 2, maybe 3, he can replace the denture and put implant in it? Would that still be avoiding him starting looking ugly and funny?
Yes, every case is different, but usually within a year, the patient loses most of the bone. But there are still techniques available that after the year that we can place implants in order for the patient to lose more bone.
I see. So basically, he should go about it relatively fast.
Yes, you cannot wait too many years.
Okay. And what about those type of dentures where you have 2 on the upper, maybe 4, 2 on the lower, maybe 4 implants, and then put the denture on it, that hybrid kind of like, is that a better fit for not to, and I'm only talking now about not looking ugly, because, even if you're a 58-year-old guy like me or whatever, we don't mind so much looking our age, but we do mind looking more than our age, even if we're, so to say, old guys. Never mind younger people and never mind ladies. But I think even guys. So would that hybrid help a little bit? Is that a good solution?
Absolutely, definitely. We recommend that. If the financially there is a concern financially, we can go that route, which is very acceptable. Patients have been living with dentures for many, many years. As you know, George Washington became a president with having no teeth, wearing the dentures in his mouth. So did
he really have a wooden tooth? Did he really have a wooden tooth? Or is that just a myth?
I'm saying that I have read different things about him. That some people say that they were made from hippopotamus teeth. Someone says made from wooden. I have not seen actually his, but I heard there is in a museum in Washington that we can go and then check it out for ourselves.
Look at his tooth, huh?
And examine it, what kind of tooth it was. But the most credible source that I've seen is that it is made from hippopotamus teeth.
Mm-hmm. Okay.
But anyway, the dentures can be more stabilized in the mouth with anywhere between 2 to 4 implants under the denture, so patients can chew better, and then they can have their dentures in the mouth without having too much problem stabilizing the denture.
And those dentures will then be holding for a long, long time, if not forever, just like an implant thing. They will be staying, basically they will not start becoming wiggle-woggly is what I'm trying to say.
Yes.
Sounds like a good deal to me. Thanks a lot, Dr. Nazari.
Thank you.